welcome back to MLab 1101, Introduction to Clinical Laboratory Science. My name is Dustin Scott Brewster, and this is going to be the second of our three-part presentation on the fourth unit of this course, Medical Ethics. So we left off talking about some individual values and how each people, depending on their background, their culture, can hold different values. So some examples of those values include honesty, freedom, life, family, hard work, religion, as we talked about in the last presentation, and something we should definitely leave off the table in any healthcare setting, integrity, loyalty, friendship, timeliness, which should not be an individual value, but a universally accepted value that we should all be punctual when coming to work, especially in healthcare, and truthfulness. Of course, there are several other values that people hold dear, but these are some good examples and some starters that we might all view differently. So let's break down some types of values. Honesty. If you value honesty, ask yourself, is it okay to clock in 30 minutes early, then sit in the break room before your shift while the shift that you're relieving is still working? I don't think so. You should be going in there, you should be reporting, finding out what's going on with patients, any information that needs to be passed off from the previous shift to your shift, and the same thing when the next shift comes in and they're relieving you. You want other people to relieve you the same manner in which you relieve them. That's integrity, and that's just being a good coworker. Ask yourself, is it okay to call in sick when you're not sick? Again, in healthcare, there's usually really tight margins, and it's an important thing whenever somebody is there to come to work. You can't call in sick when you're not sick, and it's not something that you should abuse if you are in fact not sick. Every person counts in healthcare, and it's important to be there and be a part of the team. Ask yourself, is it okay to report erroneous lab results because you don't want to stay late to repeat a questionable test? A lot of tests in the clinical laboratory are manually interpreted, and perhaps you're running late and you want to go on to the next task or get off your shift instead of repeating a result, and this could cause erroneous lab results and potentially compromise patient care. Again, ask yourself, what does honesty mean to you, and how can you implement this in the healthcare setting to practice a high degree of medical ethics? Life. People that value life, ask yourself, is it okay to have an abortion? That's not really something you should be talking about in work or anywhere in healthcare, but something that may be viewed differently depending on who you ask. Is it okay to disconnect a feeding tube from a comatose patient? Again, this is something that may happen, and somebody may have the medical power of attorney, and you have to accept the fact that that may be the best option for some people, depending on the patient's doctor or maybe the patient's medical power of attorney. Another thing that we hear much too often in the news is the bombing of innocent people. The people that are committing those bombings, they often don't feel that they're doing anything wrong, and maybe they're doing something because of their religion, their religious background, or because they feel that this is the right thing to do. Most people disagree with that, and as a result, there's a conflict between the moral compass of individuals that can be influenced by things such as religion. Is capital punishment okay? The punishment of, say, for example, somebody that blew up innocent people. A lot of people would agree that, yeah, we should have capital punishment for murderers and really bad people like that. Other people hold life above other values, and they feel that capital punishment should not be a thing. Friendship. If you value friendship, ask yourself, in what degree do you value that friendship? Is it okay to lie to a friend? Maybe a little white lie like, that eggplant parmesan tasted fantastic, when maybe it didn't taste so great. That lie is not going to hurt anybody, and maybe is going to protect somebody. Another lie, maybe your friend committed a crime and you want to protect that friend. Ask yourself then, is it okay to lie for that friend. Most people would agree that it's not okay, and you shouldn't protect somebody that committed a crime or did something wrong to somebody else. In a professional setting, would you report a friend, of which coworkers often become close friends with the amount of time we spend with one another? If you know that person is abusing prescription drugs and treating patients at the same time, most people would agree that that's not something that's okay to do, and you should, in fact, report that person, even if they are your friend. That's the right thing to do, and that's practicing a high degree of medical ethics. So, all of us have values, even though we may not be aware of where that line is drawn. That's why in the previous presentation I asked you, what are your values? What do you hold dear? What guides your moral compass? Understanding those is going to help you work better with other people that may have different cultural backgrounds than that of your own, and allow you to steer in the right direction for medical ethics. Sometimes our values don't make themselves apparent until we're confronted with a tough decision, like maybe a coworker abusing prescription drugs. We may not know what we would do until we're in that position. Working in a healthcare setting requires a comprehensive staff of medical providers. Again, we discussed this previously. In the healthcare setting and in most hospitals, they're very diverse workforce. We have people of all different cultures, ethnicities, backgrounds, races, religions, sexual orientations, and it's important that we all work together and we all understand that aside from our own moral compass and what we feel may be right or wrong, is secondary to what is right for the patient and what is right to our coworkers, and that we can unify ourselves by having a same code of medical ethics. So those ethics are often presented in a diverse pool of cultural ethics amongst the different people in a healthcare setting. Providing excellent healthcare requires the ability to look past the cultural barriers that may be present in a healthcare environment and work together as a team. Again, unifying ourselves and all subscribing to the same code of medical ethics. Different healthcare professionals have different codes of ethics. Doctors, for example, subscribe to the Hippocratic Oath. Nurses have the Florence Nightingale Oath, and lab professionals have the American Society for Clinical Laboratory Science Code of Ethics, which can be found by following this link here. So, a brief overview of the American Society for Clinical Laboratory Science Code of Ethics is basically stating that laboratory professionals have the duty to their patient, duty to colleagues and the profession, and a duty to society. So, as a medical laboratory professional, the pledge goes, I pledge to uphold my duty to patients, the profession, and society by placing patients' welfare above my own needs and desires, ensuring that each patient receives care that is safe, effective, efficient, timely, equitable, and patient-centered, maintaining the dignity and respect for my profession, promoting the advancement of my profession, ensuring collegial relationships within the clinical laboratory and with other patient care providers, improving access to laboratory services, promoting equitable distribution of healthcare resources, complying with laws and regulations, and protecting patients from others, and changing conditions where necessary to advance the best interests of patients. The American Society for Clinical Laboratory Science Code of Ethics and Pledge to the Profession can serve as a moral compass for those employed in the clinical lab and as a guide to clinical laboratory professionals. Decision making is usually really tough to do, especially when presented with issues that we often find in a healthcare setting. It's important that we each have a moral compass, and that which is provided by the ASCLS can be that compass for those healthcare workers working in the clinical lab. That's going to conclude the second of our three-part presentation for medical ethics. We will pick this back up with part 3 and the last part of this presentation